the mouth is naturally infected by bacteria. When patients start getting the signs that something is wrong and they ignore that, guys, let's get started. What's the major cause of everything that affects the mouth? Where does it all start? We all know that the mouth is naturally infected by bacteria. Regardless of if you have a very good oral health or not, you have bacteria no matter what. Of that bacteria in the mouth that will create problems like tooth decay, periodontal disease, and malocclusion, all things that we know that will need treatment will start from the same thing, which is the plaque. The way that plaque will develop is what's going to differentiate the problems that you have in the mouth. Different types of bacteria will colonize the plaque that will start above the gum tissue, and if it goes below the gum tissue, like we see here, for example, this is plaque, this is tartar. That untreated will cause periodontal disease. A different type of plaque will cause tooth decay. But, prevention will prevent anything from happening. When patients start getting the signs that something is wrong and they ignore that. So the more you wait, the more problems you have. The other problem that bacteria in the mouth will cause is that bacteria, due to the nature of the lining in the mouth, we have mucosa, which is highly vascularized, millions of vessels, right on the surface. So that bacteria will get into your bloodstream and go spread throughout the body. So it's all linked, and it all starts with the mouth. The last and the worst thing you should do is wait to see if that goes away by itself. It won't. So being ahead of the game, focusing on prevention is the best thing you can do to avoid any of these problems. So we use that technology to create a specific program for that patient. For example, our initial appointment, if you're a new patient, you're going to spend about 2 hours with us on that initial appointment, because we will basically map out your mouth through photographs, through scans, through 3D x-rays, thorough exam of your mouth that will determine if you're a healthy person to start with, if you're mild, moderate, or severe in terms of periodontal disease. But we will focus on discovering every single problem that you may or may not have in your mouth on that appointment, who will, together with our team, focus on prevention, focus on continuing care, focus on being healthy. Cavities, periodontal disease. How do you fix that? If you're not healthy, you're going to treat your mouth to get to a healthy state before we can actually beautify it.